Well, first of all, it's a great honor to be here, and I would also like to thank Aggie Hirschberg for all she has done for pancreatic cancer through the Hirschberg Foundation. I would also like to thank the Foundation for supporting the Simms-Mann Center for Integrative Oncology here at UCLA, and for recognizing that medicine alone is not enough, and that patients and their families need psychologic and other integrative care after a cancer diagnosis. Unfortunately, there is so much information and misinformation about nutrition available that this often causes anxiety and stress. I represent one aspect of how we address this at the Simms-Mann Center, where we see many people who face pancreatic cancer, and we focus on what is possible to achieve to improve symptoms, enhance wellness, and quality of life. Pancreatic cancer risk factors are well known to all of us in this room, and many of these have already been reviewed. But here's just a summary. As we mentioned earlier, stress is a big issue after a diagnosis of any type of cancer. This survey of 252 cancer patients notes that 9 out of 10 were concerned about eating and nutrition. Just imagine how much more intense this concern is when the cancer is directly affecting digestion, such as pancreatic cancer. These, as well as other concerns, are of great importance to patients and are often addressed by other members of our team at the Simms-Mann Center. The late Dean Lester Breslow, who was a mentor of mine, was a pioneer in monitoring cancer facts and figures. This type of data helps us identify modifiable risks and guide us for what constitutes a wellness-filled life. His 7 healthy habits remain excellent common sense. 1, no tobacco. 2, eat breakfast regularly. 3, get a good night's sleep, 6 to 8 hours. 4, eat a healthy diet. 5, don't drink alcohol to excess. 6, exercise regularly. And 7, avoid eating between meals. Well, for pancreatic cancer patients, all but number 7 makes sense. Snacking is important when digestive processes are stressed. Well, most of us know what we should eat. However, there are many reasons why good nutrition becomes a challenge, especially after a diagnosis. Let's look at these with a goal of reducing the barriers. When there is a congruence between what we know is healthy and what we are able to achieve, then anxiety is lowered. Depression is made worse when anxiety is high. So what nutritional challenges are we seeing? For today's purposes, I'm going to address the commonest diagnosis of adenocarcinoma of the exocrine pancreas. Some of the suggestions will also apply to those with neuroendocrine tumors, but my focus will be on those who are either on neoadjuvant therapy or are downstageable, those receiving adjuvant chemotherapy after surgery, such as Whipple, or are having radiation treatment. And I'm not going to be specifically addressing chronic pancreatitis today. First and foremost, we want to follow the Breslow healthy habits: no smoking or exposure to smoke or other airborne pollutants. You may want to add some green plants to your living spaces. For example, as these help absorb cleaning chemicals. Examples are chrysanthemums or snake plants. Another tip might be to use green cleaning products. Stay hydrated, get sufficient protein, and make sure you have at least 6 hours of sleep are keys to wellness. An evening snack of a warm malted milk drink, for example, can help with sleep, as well as provide protein that is useful during the night when cell repair is at its most active. Lavender is also a soothing essential oil to add to a tub or to diffuse in the air. Manage anxiety with the support of loved ones and a strong social network of friends and support groups. Mindfulness, meditation, and other mind-body activities, including Qigong, may be helpful, and these are all offered at our center. Here are those vegetables best purchased organic, sometimes called the dirty dozen. We also need to You'll be able to see these slides in the presentation that's provided as well. And if anyone would like a copy of any of these things, please let me know. We also need to address possible micronutrient deficiencies or insufficiencies that often arise after surgery, especially if the region where most of absorption is removed, as was mentioned earlier. The key nutrients that may be affected are iron, I'm sorry, I think I went on too far. Yeah. Iron, selenium, zinc, vitamins A, D, E, and K, which are fat soluble, and the B vitamins B12 and folate. Arginine is an amino acid or protein building block that is also very important around the time of surgery. Nut butters or dark chocolate are good sources of arginine, also very tasty. Appetite is easily affected by any change in the digestive tract. It is also affected by stress, by altered taste sensations, or a side effect of some chemotherapy or other medications. Post-Whipple patients frequently describe nausea and poor appetite. Slow stomach emptying or gastroparesis also exacerbates lack of appetite through regulatory feedback loops. This is one cause of unwanted weight loss or cachexia. Sometimes this is a result of hyperglycemia, which we will address in a moment. But other times it is because the nerve signals that stimulate peristalsis, or moving the time through the body, through the digestive tract, has been affected. Opiate pain medications or narcotics also slow peristalsis. Here are a few ideas to improve appetite. Small, easy-to-digest snacks or ready-to-drink beverages are now more conveniently packaged than ever. Homemade ones, like protein smoothies, are also helpful. It's a good idea to plan ahead and keep a few close by for moments when your appetite is low, but you need your medicinal amounts of protein and fluids. Sensitivity to taste and smell is often enhanced during treatment, so it is important to reduce exposure to unpleasant odors. Prepare food in well-ventilated areas, for example. Ginger is a safe and popular way to reduce nausea. There is also a ginger and spearmint inhaler that some people find helpful, for example, or ginger-flavored drinks or chewables. Eat in a relaxed environment. It's not a good time to watch the news, but rather to put on some peaceful music or eat with loved ones. Colorful garnishes are also helpful, as are newer flavors, such as umami, which is found in many Asian dishes. If none of this works for you, then you may want to discuss with your oncologist if some of the prescription appetite enhancers may be helpful for you. Anxiety around eating is sometimes because of an episode of what is called the dumping syndrome. That's been discussed a little bit earlier. This occurs post-surgery in a few people and may persist for up to 6 months. But because it feels so awful for the 20 minutes or so until the episode passes, it's natural that eating afterwards becomes more anxiety-prone. There are ways to reduce its likelihood of occurring, however, and just having this knowledge can reduce anxiety a lot. Guar gum, xanthan gum, and modified citrus pectin are types of soluble dietary fiber that help hold fluid and slow passage of food through the gastrointestinal tract. This allows a longer time for messages to pass to the brain and reduce the sudden emptying that triggers those bad feelings. Visualization can also be a very helpful tool. I often help patients come up with a visualization that works for them. As I touched on earlier, the importance of managing blood sugar levels. Hemoglobin A1C and fasting glucose are important monitors of how well glucose is handled. Postprandial glucose or spot tests are also valuable. Glycemic load is a description of individual foods with a glycemic, gly means sugar, emic blood, index, which combined together in a snack or meal form a glycemic load. This is one way to measure how rapidly glucose levels change in the blood after eating. Simple sugars, such as found in sodas, juice, or other sugar-sweetened beverages, have high glycemic loads, so we need to avoid these completely, or add soluble fiber, such as a teaspoon of guar gum like benefiber, to lower the load. Soluble fiber helps normalize blood sugar. Cinnamon can also be helpful, and an idea might be to add some applesauce and cinnamon, which would lower the load much more than having just apple juice. Poor digestion is common as a result of any of the treatments for pancreatic cancer. Symptoms include painful gas and bloating, especially after eating, loose stool or diarrhea, and loss of weight. If the stool is pale beige or light yellow and there are fat globules in the toilet, then malabsorption of fat, as well as fat-soluble vitamins, is likely going on. This is best addressed with the addition of digestive enzymes, and your oncology team can direct you as to which would be the best ones for your needs. We won't go into details here, but suffice it to say this is very important to address. Diarrhea sometimes arises because of malabsorption of other foods, including many carbohydrates. Most people find that they can no longer tolerate cow's milk, so we recommend switching to almond, rice, or soy milk. Lactose-reduced milk may be tolerated in small quantities. Sugar alcohols like xylitol and sorbitol can also cause digestive discomfort and should be avoided. Some sugar-free products contain these, so read labels carefully. Inulin is also a more recent sugar substitute that's often found in low sugar or sugar-free protein bars, and that can also be very gassy and uncomfortable. Constipation is another challenge resulting from changes in gut motility associated with many of the treatments for pancreatic cancer. Pain medications, as noted earlier, are also a common cause. Motility stimulators like senna can help. Over-the-counter products containing senna include Senocot S, Prunelax, or Smooth Move Tea. The two main methods of overcoming constipation are by pulling fluid into the large intestine or by stimulating peristalsis. Lactulose, magnesium salts, or Miralax pull fluid in, whereas senna or bisacodyl stimulate the walls of the intestine to contract and clear the bowel. Insoluble fiber-rich foods or supplements, such as psyllium husk, Metamucil for example, may also be helpful, along with plenty of fluids to prevent constipation. But bowel regularity is a highly personalized topic, and of course if you overdo the treatment for constipation, you may cause diarrhea and vice versa. This diagram is to demonstrate the value of balancing the digestive enzymes, dietary fiber, and the resulting healthy level of beneficial microbes, also called probiotics. Foods that support healthy colon functioning are called prebiotics, as they support probiotic balance. These foods also support healthy immune functioning and include complex carbohydrates or dietary fiber found in beans, vegetables, nuts, and whole grains. This is one reason why a plant-based diet is so healthful. So with all of this in mind, which foods would be best to eat at this time? Protein-rich foods delivered in small portions are ideal. Sometimes it is easiest to get these in the form of ready-to-drink beverages, as they provide the essential number of grams of protein needed, along with vitamins and minerals. For many people, the amount of protein required is in the range of about 80 grams a day, which would look like about 15 grams for breakfast, 25 for lunch, 25 for dinner, and with a smoothie to provide another 15 grams for a total of 80 grams. If you skip a meal, then the smoothie comes in helpful. More is fine, but we should always be aware to address what's called a medicinal amount, which is what's needed by your lean mass, and we determine in our center using bioimpedance analysis. Here are some examples of high-protein foods, including Greek yogurt, nut butters, and tofu, and some other suggestions for how to increase protein in your diet. When comparing ready-to-drink beverages, we see that most provide protein, but some have sugar and no fiber, so they have a high glycemic load, which would not be recommended. Boost Plus, Ensure High Protein, Mix 1, or Orgain would be preferred choices for this reason. Ensure Clear is highlighted as this is suitable for use on a clear liquid diet. We are all different. We have different health histories, and some of us may be exceptional responders. As we learn more about our molecular individuality, we can optimize wellness and reduce unwanted interactions of bioactives. It can be very helpful to have a personal guide who is knowledgeable in this emerging field of genomics. A few examples of interactions between chemotherapy and supplements should be addressed, and I'm going to talk about a couple. Curcumin is a spice. It's an active ingredient from turmeric, which is found in curry. It may enhance the effectiveness of gemcitabine. So this is a valuable spice. However, you should always inform your healthcare team if you take this as a supplement, as it has a known interaction with chemotherapy. Curcumin has been shown to enhance the effectiveness of gemcitabine in pancreatic cancer cells. NF-kappa B and other regulatory cytokines or messengers are involved. Another interaction relates to liver enzyme interactions. Cytochrome P450 CYP2C9 interacts with the blood thinner warfarin, and it also interacts with curcumin. So it's important to let your healthcare team know if you're taking curcumin, what form it is in, and the dosage. Another interaction known with the common chemotherapy, Abraxane or paclitaxel, is DHA and EPA. These are fish oil, and they have been found to accumulate in pancreas tissue and alter the way that programmed cell death or apoptosis occurs. In other words, if you're taking an omega-3 supplement, it is important that you share this with your healthcare team because of potential interactions. This is a diagram which I've sort of put together over the years to demonstrate how omega-3s, in the past, when we were eating many more grass-fed meat from grass-fed animals, they had more omega-3 in them. Nowadays, we tend to what they call finish animals with corn, and this means that they have much more omega-6, which actually is pro-inflammatory. So the more we are eating cheese or animal fats that are from animals that have been fed corn, the more we need to balance it out by increasing the amount of omega-3. So omega-3, some people elongate flax, for example, walnuts, or grass-fed animal fats very well. They make them longer into these EPA and DHA, but some people don't. So this is very personalized. It's why some people can go on a vegan diet and feel really healthy, and some people could become vegan and they feel terrible. And that's because of their own individuality. But we do know that EPA, and especially DHA, which is very important for brain, renal, and retinal health, is becoming more and more available for us in an algae source. These are algae that have been farmed to create DHA and increasingly EPA. You see, actually there's almost none in it, but the organic milk that says omega-3 on the top, that actually has the algae source, so it doesn't repeat with the fish taste on you. But again, an omega-3 supplement, if you should be taking it, we need to make sure that your healthcare team knows that. Foods that contain some phyto or plant nutrients that may provide protection from environmental toxins, which we know are associated with pancreatic cancer risk, everything from smoking to all the other environmental toxins I showed you in the beginning. So the garlic family of vegetables are rich in sulfur compounds that stimulate liver detoxification. The other ones that are good are garlic, scallions, shallots, and onions. Those from the brassica family include watercress, which is one of my favorite vegetables, cabbage and other cruciferous vegetables, and berries rich in pigments, especially black raspberries. And I believe that MD Anderson has been doing some interesting work looking at black raspberries and neuroendocrine pancreas cancer. So putting this all together, what should you eat now? As we said before, this is highly personal. Food is one of the greatest pleasures in life, and one of my goals is to help improve the digestion of my patients so they may enjoy food as fully as possible. Here are some resources for you, and again, I think these slides are going to be available later. As I mentioned earlier, the Sims Mann Center is dedicated to enhancing the wellness of those touched by cancer and this particular diagnosis as well. Thank you so much for your time.